Hello everyone, so we will be starting with genital disorders, which is genital disorders in children. Hydrocele and inguinal hernias are from failure of closure of processus vaginalis, and the tendencies are frequently identified on neonatal and infant physical examination. The cuticle subsequently is a surgical emergency, while vaginitis is common in girls. Inguinal conditions and biology in the fetus assess descent from its origin on the posterior abdominal wall down the inguinal canal into scrotum guided by ligament called tabernaculum. Structures that are found in scrotum in a male, testes, vas, and Douglases or labrum in a female vaginal gland within the uterus pass through the abdominal wall and pick up layers corresponding to those of the abdominal wall. In a male, these make up the governing spermatic part. In both male and females, there is a remnant of peritoneal imagination. The processes, which are endless, which if it remains patent and is continued to the abdomen, explains why abdominal contents of fluid can become hydrocele hernia, respectively. Inguinal hernia are common, occurring in up to 5% of boys and are even more common in mature babies. The hernia is usually caused by a persistently patent process vaginalis and emerges from the deep inguinal ring through the inguinal canal. This is an indirect hernia. Direct hernias are uncommon in children. Hernia presents a lump in the groin which makes them into the scrotum or labium. They are usually asymptomatic. They may be intermittent, become visible during straining or coughing. On examination, sometimes the lung can be palpated in the groin. The continence in hernia may become irreducible, incarcerated, causing pain and sometimes intestinal obstruction or damage to the testes from progressive edema. Venous and lymphatic obstruction. In these circumstances, the lump is tender and the child may be irritable and may vomit. The risk of incarceration is much higher in infants than in older children. Most hernia can be successfully reduced by taxes, gentle compression of the line of inguinal canal with foot and the surgery can then be performed when any edema has settled and the child is well, if reduction is impossible, emergency surgery is required because of the risk of compromise of bowel. Testes in girls only may descend into hernia if the ovary becomes carcerated. It cannot be reduced in the same way as bowel and requires formal surgery reduction. Treatment for non is by open or laparoscopic surgery and laparoscopic hernia repaired internal in the smooth inside the anal cavity, which has a somatogenetic open repair of no physical damage to the vas and vessels, which are handled in open hernia and from surgical repair is indicated for anyone who is infants to lower the risk of incarceration. Additionally, has the same underlying knackness in hernia, but the period process of genetics is not wide enough for bowel to pass through, but can be filled with fluid. Hydrocele are usually symptomatic or subjectively blue. They are usually identified during the routine physical examination, and they may present during viral infants when fluid in the intra-abdominal cavity increases and passes down the patent system vaginalis. It is usually possible to feel the testes, however, it tends to hydrocele. Sometimes the hydrocele is separate from the testes as it is an acquired. The key to differentiate a hernia from hydrocele is the ability to palpate above the hydrocele. Hydrocele usually trans eliminate. This is about one hernia into mature boy. Contains one, and this also will be the hydrocele. And this is the normal embryology of testicular descent. This is the normal embryology. Testicular ventricular posterior, wall peritoneum, peritoneum one ring, and tuberculum. So it can normally send including third trimester. It has a phallus process vaginalis down to vaginalis, and this is normally technically obliterated. This is vaginalis and all structures, vas and vessels, a great wisdom body testes, and vaginalis. And biblical variants of hydrocele, and one of hernia is containing bowel, anatomic image of hydrocele scrotal, hydrocele of the point. And these are normal growth structures showing remnant of vaginalis above and medium to poor structures. That was that. So, although the process is very proceed, showing cumulative process of time much of the left hemisphere, although the progressive vaginitis is often patent at birth, usually closer within months. The gentler hydrocele therefore resolves spontaneously, can be managed expectantly. Surgery may be considered if it persists beyond the first 2 years of life, but resolution may take longer than this. In a girl, hydrocele is much less common than in boys. Varicose is the swelling comprising dilated varicose testicular veins and occur in up to 15% of boys, usually at puberty. It is usually asymptomatic but may cause a dull ache. On examination, it's been bluish color and feel like a bag of worms. Sometimes testes is smaller, softer than normal. Management is conservative. If asymptomatic occlusion of the genital veins can be achieved by surgical ligation through the groin necrosis, typically organogeological embolization. Undescended testes, most undescended testes originate from the rest of the testes along a certain pathway of descent, and undescended testes is present up to 5% only one term infants, but is more common for mature infants. By 3 months of age, only 1% is still undescended. Diagnosis should ideally be made at the routine physical examination in newborn. The testing may be felt in scrotum or may need to be passed by gentle pressure along the line of the inguinal canal to the scrotum. Anderson Jason may palpable impact with palpable Anderson Jason usually felt in the groin but cannot be manipulated into the scrotum. Occasionally it can be palpated below the external line inguinal ring but outside the scrotum, so-called ectopic testes. If the testis is impalpable, it may be in the inguinal canal but cannot be defined, or it may be intra-abdominal or absent. If there are bilateral impalpable testicles, the karyotype must be established to include the disturbance of sex development. Testes may also be retractile when the testes present in the inguinal canal, but can be manipulated into scrotum with ease and without tension. Action of the cremasteric muscle seen in the stage gives the effect of light touch on the inner thigh, which of the testes. Parents of boys with the retractile testes often report their testes sometimes obvious, particularly when the boy is warm and relaxed, sometimes not. Testes should be therefore always be examined in a warm, relaxed environment. Investigation management imaging is not helpful in the assessment of an undescended testes. If an undescended testes is identified in routine examination, the decision to operate should be delayed for several months as subsequent descent population are cardiopexy is a surgery risk, but the testes disposal was performed within the first year of life. To last cell examination as adults and this testes, this busting has tenfold increased risk of an isolated life. When the testes down does not change the stress, but being able to perform some examinations and when adult means that any labs development at least by when treated. For cosmetic reasons reaching the same symmetrical appearance as in boys, this may be of psychological benefit if the disease is absent, if prosthesis can be inserted when included. To reduce risk of torsion and trauma compared to ground location, to improve fertility, testing needs to be the scrotum below body temperature in order to allow spermatogenesis. This effect is probably marginally neutral and the same testing that is more important than biometry. There is some evidence that delaying orthodoxy beyond the first 2 years of life would also affect testicular development. Where testis is impalpable, about 10% have regressed in development and are in fact absent. Abdominal laparoscopy allows both diagnosis and treatment when a testis is retractile, follow-up is recommended because some high testes require surgery to place them in the scrotum. Whether or not this is true assent of the testis is controversial. And this testis should be referred to pediatric surgeon when detected if surgery is required. The optimum time is within the first year of life. Testicular pain, acute scrotum, torsion of the testes. This is commonest in post-operative boys, but may occur at any age, including newborn. It's usually very painful with redness and edema of scrotum skin. However, the pain will be localized to the groin and lower abdomen, highlighting the need to always examine the testes in a boy presenting with sudden onset pain in the groin, abdomen, or scrotum. It must be distinguished from an incarcerated hernia and missing testes is that increased risk of torsion as the testes lies, thus will stay on its attachment to somatic cord, the so-called flappable testes torsional testes must be treated within hours of the onset of symptoms to lower the risk of testicular loss. In fact, surgical observation, any acute scrotal presentation is mandatory unless torsion can be treated with surgery. Fixation for contralateral testes is also performed because increase increases for contralateral torsion. The outcome is variable depending on time to correction. If it be delayed, testicular loss is likely. This is testicular torsion, twisted oblique muscle testes, back testes, severe torsion, headated torsion, small hemisphere. Doesn't feel in my this one, I will see as slight and swollen. Testes in perinatal testicular torsion, testicular loss is almost inevitable and results of friction will not perform the respiration. Urgency but rather method testes atrophy. The unilateral remaining testes can be fixed selectively when the infant is over. Torsion of the appendix testis, a testicular appendage, hydrated or monogamy is a malarian remnant usually located on the upper lobe of the testis. Torsion of the appendix testis tends to affect prepubertal boys as more common in torsional testes. Pain involves in days but is not as dramatic as in testicular torsion. Short expiration excision of the appendage is often necessary because it cannot be differentiated reliably from torsional testes. The blue dot can be seen through the scrotal skin and penis. Controllable analgesia surgery may not be necessary. Other acute immunoviral conditions, infection may cause acute scrotum attenuated bronchitis is common in infants and small children, and more likely with a pre-existing logical or anorectal malformation. As it may be indistinguishable from torsion, scrotal expression may be necessary. Doppler ultrasound with flow pattern in intestinal blood vessels may allow differentiation of the stigmitis from torsion of decibel must not place clinical evaluation. A urine sample should be obtained to identify an associated urinary tract infection, but should be sent at option for microbiology to characterize the nature of the infection. But infection may be bilateral or bacterial or viral antibiotics particularly in idiopathic scrotal edema, there is redness and swelling extending beyond the scrotum into the thigh, perineum, and suprapubic area, but the testes are normal and non-tender. It requires analgesia and review may recur. An incarcerated hernia may also cause an acute scrotum, although symptoms usually affect the groin. Trauma to scrotum is an uncommon cause of testicular damage, but may need surgical exploration, debridement, and repair. Sexual abuse needs to be considered in all genital injuries. Recurrent scrotal pain in boys can be difficult to manage. Any associated symptoms or signs such as swelling or redness should be regarded as intermittent torsion and the test is fixed. Sometimes prophylactic fixation is required to exclude intermittent torsion as a cause for recurrent pain. Torsion of the testes may be excluded when emergency expression necessary because an acute scrotum delay leads to testicular loss. Abnormal weakness foreskin. Normal foreskin does not retract and the same retraction should not be attempted. At 1 year of age, about half of them circumcised boys have a non-retractile normal foreskin. Only 1% boys below 16 years have a non-retractile foreskin. The prepuce develops inherent to the underlying glands and eggs production to non-carotidized cellular and mediatal squamous epithelium in an environment where urine can cause inflammation or even ulceration. This can manifest as an ammoniacal dermatitis, napkin rash, and children with an superficial opening can be reddened, and so it usually only needs reassurance and attention to reinfection. This needs to be differentiated from infection or pyelonephritis, prostatitis, where the redness is more extensive initially, there is a further discharge. The infection is usually bacterial and needs antibiotic treatment. Topical systemic malignant foreskin or urination is a common cause of parental concern. It can be traumatic with certain causes of any shock. Can has no functional consequence, does not present function, and does not need intervention. Another cause of parental concern is subperficial smegma. It appears as a lump which grows briefly, seemingly another non-retractile, partial retractile foreskin is yellowish and malleable and simply comprises the discriminated skin and secretions. There is no need to intervene. It will discharge in due course with typical appearances like cotton cheese when the superficial addition breakdown. Non-retractile foreskin of fibrosis. When retraction is applied gently to a normal foreskin, the skin at the superficial opening is seen to grow, even if it does not necessarily foreskin that's pathologically non-retractile. Non-retractile will not do this, and true retractile with the glands muscles secretion. Fibers This differentiates a foreskin is simply non-retractile normal physiological from one that is problematic. Just five noses. This is smegma. This is normal foreskin in an infant. The common explanation that gives rise to true phimosis palainitis is odontogammal trans, which gives rise to progressive scarring, which then extends onto the glands and the median shows its typical appearance circumcision is indicated. This is like a causing a true phimosis. It is paraphimosis in an age-reduced retracted foreskin, most common in post-puberty boys. The gland swells. If pubes is not reduced, it may result in compromise of blood supplied to the glands. Treatment when ruptures in emergency was very required during anesthesia. Paraphimosis is no longer considered to be required circumcision unless the foreskin is abnormal, as would be so. And circumcision remains a traditional Jewish and Muslim religion as is a non-religious cultural offense in North America. Medical reason for circumcision includes use of wasn't to fibrosis, recurrent balanitis, prostatitis, causing refractory symptoms of excessive recurrent urinary tract infections, especially in parents of congenital neuropathy, such as posterior walls or resembling tragic reflux, or if female result symptom. If access to the urethra is required, liable for intermittent catheterization. There is some iron circumcision affords protection against transmission of HIV and HPV, and there are programs promoting circumcision in infants, Indian adult males in some countries with high prevalence of HIV infections. And complications following circumcision uncommon but include bleeding, laceration of exposed genital skin, and subsequent neonatal stimulus. Non-infant foreskin normally physical fluid. Hypospadias is an incidence are to 1 in 200 what is thought to arise from failure of development of ventral closure of tissues of penis. Typically, there are three features, although their occurrence is variable. Abnormal site of ventral urethral penis, the usually it is a variable position, but most 20% is distal shaft of the glans penis. Ventral curvature of the shaft of penis formally called the woody and most apparent on eruption. Wooded appearance of force in question appearance because of ventral force and deficiency, but of no functional significance. This is rarely an associated underlying disorder of sex development, only rarely another congenital urinary tract national surgery may be performed for functional cosmetic reasons. The ultimate aim of hypospadias surgery is to allow a boy to pass through in a straight line while standing and to have a straight erection. Surgery, if needed, is usually performed in the first 2 years of life. The common surgical complication of breakdown of the repair or meatal narrowing. It is important that the boy with hypospadias is not circumcised before the repair, as the tissue of the prepuce may be used in the repair itself. Infants with hypospadias must not be circumcised to preserve tissue for reconstruction. Very penis. Parents are sometimes concerned that boys' penis looks small. This is usually from variations in the penis due to skin attachment and or a fat pad in delivery children, making penis look buried. It improves with growth of the penis after puberty, is normally latest most common time, flat look on the shaft and penile stroke. These are the varieties, and these are the penile shaft, dorsal, wooded, profuse, converging curvature, and for the and hypospadias. This is some genital conditions in male infants, inguinal hernias. Surgical repair of inguinal hernias in infants should be performed promptly to prevent bowel incarceration and strangulation. I was infant routine newborn physical and health examination usually resolve spontaneously. Understand their testings, common up to 5% term, and both 1% at 3 months phase. Testing and missing that requires osmogen or chydopexy. If understanding incompletion may require laparoscopy to identify if the test is present. If value driven by people, testes urgent character essential. Retractile testes usually do not require surgery. Acute scrotal condition may occur at any age, but torsion testing must be considered not only for acute pain of the scrotum but also for acute abdominal joint pain. Scrotal surgical excavation is required unless torsion testing can be reliably excluded. Non-retractile functions normally in preschool children. Circumcision not recommended routinely, but is still traditional in some communities worldwide. Happens between 1 and 200 boys, majority usual neonates at abnormal site, penile curvature, and hooded foreskin surgery may be required in first 2 years of life. Infants hypospadias must not be circumcised. Genital disorders or normal anatomy, admission of the normal female anatomy and investigations is crucial in order to avoid incorrectly diagnose them as pathological condition of recognized disorders of sex differentiation, newborn female genital mutilation of sex and sexual abuse. Vulval genitis vaginalis is a common form of redness of vulva, and infants is often due to appearance due to pneumoniacal dermatitis. Less often the vulva is infective, occasionally with candida infection. Vaginal discharge is common and is usually innocuous unless it is green and offensive, which meant it may indicate infection. Foreign bodies are more often suspected than found. They are usually actually rare. The red flag symptom is a bloody vaginal discharge, which needs referral to a specialist as vaginal growth. Myosarcoma is a rare but important cause in preschool girls, labral adhesions, fusion of the labral nerve, and may possible local irritation in the pre-pubertal girl. There is usually an adequate orifice for the passage within the characteristic appearance is of superficial fusion of the labral minora with a translucent or even slightly bluish area of fluency tissue between the labia. Appearance sometimes raises parental concern about abnormal vaginal development, although these conditions are rare unless the labral adhesion causes significant symptoms. No specific treatment is required. Topical corticosteroids or estrogen can be helpful to lyse the adhesion, especially which allows underlying introital anatomy to be seen with the lesions. Common examination may see the formal division of the lesion should be undertaken only exceptionally because of the high rate of recurrence. It says blood serum gelatin must be investigated. Genital condition for more positive infants is usually due to recurrence. People addiction tends to require more treatment as indicated and is symptomatic. That is all of this.